Is there a silent killer lurking inside you or a loved one? What I'm referring to is hypertension or high blood pressure. Hypertension is often called the silent killer because people have an elevated blood pressure with no signs or symptoms that may be causing damage to the heart, the circulatory system, or other organs of the body. I have been a nurse for almost 12 years, and taking the blood pressure is one of the first skills that I learned, and I've continued to use it every day in the profession. So today I will discuss what the blood pressure is, factors that affect the blood pressure, what is required to monitor the blood pressure, and demonstrate how to take a manual blood pressure. So first, let's get started. What exactly is the blood pressure? It's the tension exerted by blood against the arterial walls of the body. You have your systolic reading, which is when the heart contracts. It's the first sound heard with the stethoscope, and is referred to as the top number of your blood pressure reading. Then you have your diastolic reading. That's the relaxation between beats. It's the second sound heard with the stethoscope, and is referred to as the bottom number of your blood pressure reading. Normal blood pressure is considered to be 120/80 or below. So now let's talk about factors that affect the blood pressure. Heredity or family history. These are factors that we cannot control. Alcohol, smoking, and caffeine. All of these elevate the blood pressure. And then there's anxiety and stress. There is something called the white coat syndrome, that is stress from being in a medical facility that can elevate your blood pressure. And people with this can usually have a normal blood pressure reading at home. You do need a proper size cuff to get an accurate blood pressure reading. If the cuff is too small, you can have a false high reading. If the cuff is too large, you can have a false low reading. So now let's talk about things that you can do to lower your blood pressure. These are called lifestyle modifications. Healthy diet, an exercise routine, if you're obese, weight loss, and then work on stress reduction. If these measures do not work to bring down the blood pressure, you may need prescription medications, and these will be prescribed by your physician. If you do not have a family member or a friend who can take your blood pressure for you, there are other options. You can purchase an automatic blood pressure machine from the pharmacy. You can use this at home, and it automatically takes the blood pressure for you. You can use the automatic cuffs at the local pharmacy, or you can check with your doctor's office. Many of these offer free blood pressure checks. So now, what is required to monitor the blood pressure? You need a blood pressure cuff. You need a stethoscope. You need your eyes, and you need your ears. So first of all, your patient will need to be sitting, their feet flat on the floor. You need to apply the blood pressure cuff 1 inch above the brachial artery. You need to take your stethoscope, and you're going to listen. Then apply it here to the brachial artery. You're going to watch your monitor here. You're going to listen. Continue to listen till you hear the first beat. And then the second beat. So we have a blood pressure reading of 102/70, which is an excellent blood pressure. So today, I have explained what the blood pressure is, the importance of monitoring the blood pressure, factors that affect the blood pressure, options for checking the blood pressure, and demonstrated the proper technique. So now I am asking everyone to use this education, take an active role in your health, and not be a victim of the silent killer. Thank you.